We've been talking about ion channels for a while. Let's focus in on different kinds of ion channels. There are some ion channels that are always open. We call those leakage channels. We're not really going to discuss those because they don't play a big role in what we need to know. We're going to talk about gated channels. Gated channels are channels that are closed most of the time, so there's like a gate that closes the channel, and then the gate can be opened by something. So just like in your yard, you have a gate, keeps all the riffraff out, and then you can open the gate and let the riffraff in. So gated channels open and close in response to a stimulus. And there can be different kinds of stimuli that open the gated channel. So this is going to result in neuron excitability and a change in membrane potential. So remember, a channel, an ion channel, when it's open, it will allow charged electrical particles, ions, to flow across. That's going to change electricity. That's going to create electrical current. That's going to change the membrane potential. And that's how the nervous system works, because it's your body's electrical system. So there are three kinds of gated channels. Voltage-gated channels respond to a direct change in the membrane potential. So what that means is that they are opened by a change in voltage. So look on the left side of the illustration. See the green channel there? When the electricity changes, the channel opens. Now we've seen voltage-gated channels before. The calcium release channels in the terminal cisterns of the sarcoplasmic reticulum. Remember, they were opened by the muscle action potential flowing down the T tubules. So it was electricity that opened those calcium release channels. They were voltage-gated channels. Channels, ion channels, that are opened by electricity. Then there's also ligand-gated channels. Some people say ligand. I don't care. It's the United States of America. You pronounce it the way that makes you feel good about yourself. So I say ligand usually. So ligand-gated channels are opened by a chemical stimulus, which for our purposes, studying the nervous system, are going to be neurotransmitters. We've seen these before. At the neuromuscular junction, acetylcholine would bind to the receptor, and that would open an ion channel, right, creating the muscle action potential. So that was a ligand-gated channel. There's one other type. Mechanically gated channels respond to actual mechanical pressure. So for the most part, we're only going to be caring about voltage-gated and ligand-gated channels. For the nervous system, that's all we're going to look at. When we get to the senses, I'll just remind you again about mechanically gated channels. So, for example, the pressure receptors in your skin. When somebody touches you, the physical pressure of touch actually physically pushes the channel open. Then ions flow through, creates an action potential, goes to your brain, and then you can say, look at that person, you say, touch me again, I'll kick your ass. So, mechanically gated channels we're going to kind of forget about for now. We're mostly going to be looking at voltage and ligand-gated channels. That's what the nervous system is all about. So, voltage-gated channels. Voltage-gated channels respond to a direct change in the membrane potential. Okay? In particular, they result from a depolarization of the membrane. So, depolarization means making the charge of the membrane more positive. So, look in the illustration. Look on the left-hand side. See, we've got a potassium channel. Isn't it cute? It's got a little ball and chain, just like some of you have a ball and chain. Here the little ball is blocking the channel, so right now potassium can't get through. Notice we have that voltage is negative 70 millivolts. What's the name of that charge again? Do you remember? That is the resting membrane potential. And then here's what can happen. Something can cause the membrane potential of the channel to change. And in this case, so if we go over to the right side of the illustration, look at how the voltage has changed to negative 50. We call that depolarization. It's become more positive, right? From negative 70, if we were to go more negative, we would go negative 75, negative 80, negative 85. Going more positive means going negative 65, negative 60, 55, 50, and so on. So notice, going from left to right in the illustration, we have depolarized the membrane, and it was the depolarization that caused that little ball to swing open. And now potassium gets through. This is a classic voltage-gated channel, opened by depolarization of the membrane. That caused the channel to open, and now the ions can get through. They couldn't before. They can only get through once the channel has been opened by depolarization. And again, we saw this before. Calcium release channels in the terminal cisterns of the SR, those were voltage-gated channels. The muscle action potential came down the T tubules, ran along the terminal cisterns, and opened the little garage doors and let the calcium out. So in this particular slide, it's a voltage-gated potassium channel. However, in the terminal cisterns, it was a voltage-gated calcium channel. All right? So you can have voltage-gated channels for lots of different ions. In contrast, here is a ligand-gated channel. All right? So they're one of the three types. They are opened by a chemical stimulus, and for our purposes, it's going to be a neurotransmitter. So when a neurotransmitter binds to the receptor, which is part of the channel, it opens or it facilitates the opening of an ion channel. So look in the bottom left. Here you see we're at the neuromuscular junction again. Here's acetylcholine coming down. Notice the channel right now is closed. Once again, it's a potassium channel and a sodium channel and a calcium channel. It's in general what we call just a cation channel. So on the left-hand side, the channel is closed. Then look over to the right. Once the acetylcholine binds to the receptor, it opens the channel. And now all those cations can flow through. Okay? So this is a ligand-gated channel. In this case, it's just a general cation channel. Lets everything through. But remember, channels can have selectivity mechanisms. So we could have one that only lets sodium, or only calcium, or only potassium, okay? And again, the ACH receptors at the NMJ were ligand-gated channels. So let's move on and talk about graded or local potential. So remember when we first did the overview of the nervous system, we said that the action potential traveled down the axon. When it got to the axon terminals, it caused the release of neurotransmitter. The neurotransmitter would then bind to receptors on the dendrites, and then that would open, in this case, ligand-gated channels. And I mentioned before that we called those graded potentials. So the action potential occurs on the axon. Remember, A for action potential, A for axon. And it's caused by voltage-gated channels. In contrast, on the dendrites, we have ligand-gated channels, and those cause graded potentials or local potentials. Some books call them one, some books call them the other. I normally call them graded, but you should know both names, okay? So what's going to happen here? We're going to have small deviations from the resting membrane potential of -70 due to the opening of ligand-gated ion channels. So, for example, depolarization, the flow of ions, causes the membrane to become more positive. So look in the lower left of the illustration. So see where we have a depolarizing graded potential? It's the one with the green line. Look what's happened here. The membrane was at -70, and now we've opened an ion channel, and as a result of opening the ion channel, it's gone up to like -65, now all the way up to -60. That's a depolarization because we're going more positive. What kind of ion channel would we have opened? Sodium would be an example. If we opened a sodium channel, remember, sodium being kept outside, sodium would flow inside the membrane, and therefore sodium would depolarize the membrane because the membrane was at -70. Now as positives flow inside, -70 is going to become more positive. So that's a depolarization, okay? That's what we have in the bottom. We can also have what's called a hyperpolarization. So look in the upper part where we have the red line, all right? We're going from -70 down to whatever, -73. What kind of ion channel would cause this to happen? Yeah, chloride. So if we had an ion channel for chloride, it was a ligand-gated channel, and we opened that channel and it allowed chloride to flow through. Chloride would come flowing inside, and it would make -70 more negative, all the way down to -73 or whatever. So get used to these terms. They're never going away. Depolarization means making the membrane more positive. Hyperpolarization means making the membrane more negative, all right? We say that these signals are graded because they vary in amplitude or size depending on the strength of the stimulus. So, for example, if somebody just lightly taps you on the face, that would cause some ligand-gated channels to open, but since it's a light tap, only a few channels would open and only a few ions would flow through, so we would get a small graded potential. But what if somebody really slapped you hard? Damn, that hurt. Yeah, that would cause a lot more channels to open, a lot more ions would flow through, and we would get a much bigger graded potential. Remember, the action potential was always the same size. That wasn't true for the action potential. All action potentials are the same size. The size of the stimulus does not change the size of the action potential, but graded potentials do. Graded potentials are graded because they can have different sizes depending on the strength of the stimulus. Big stimulus, big graded potential. Small stimulus, small graded potential. Okay, see how easy? And the signals are localized, meaning that they're only going to travel usually as far as the axon hillock. So in the upper part of the illustration on the left, see the picture of the whole neuron there? So we're going to have graded potentials flowing down the dendrites, but they're only going as far as the axon hillock, which is a relatively short distance. Remember, on the other hand, the action potential travels all the way down the axon. So action potentials are long distance, graded potentials are local. That's why they're also called local potentials, okay? And for the most part, the way we're looking at it, we're going to see graded potentials happening mostly on the dendrites and on the soma, and action potentials are only on the axon. So let's take a look here. Graded potentials result from what kind of gated channel, whereas action potentials result from what kind of gated channel? Did you pick up on this? I mentioned it just a couple slides ago. So, graded potentials are caused by ligand-gated channels. We're opening ligand-gated channels and allowing some ions to pass through. Action potentials are caused by voltage-gated channels. We haven't looked at that yet. We haven't looked at the details of that. We will coming up. So, graded potentials from ligand-gated channels, action potentials from voltage-gated channels. All right, keep that in mind. That's a big difference between the two. Let's keep talking a little bit more about graded potentials. So, if a neurotransmitter opens a chloride channel, then chloride is going to flow into the cell, okay? So we would have a hyperpolarization. That's what we're seeing in the bottom. See where it says inhibitory synapse? So GABA, by the way, refers to a neurotransmitter. You're going to be learning about GABA. That's one of the neurotransmitters I'm going to make you learn about. So notice what happens here is we've got an axon terminal releasing GABA, a neurotransmitter. That's causing the opening of ligand-gated channels that are letting chloride through. Notice chloride is going to cause a hyperpolarization. It's going to make the inside of the membrane more negative. There's a special term we use in this case. We say this is an inhibitory postsynaptic potential, an IPSP. So in the synapse, notice again, looking at the bottom illustration here with the GABA, on the left-hand side we see the axon terminal. That's the presynaptic side of the synapse. And then the side of the synapse that has the channels, the ligand-gated chloride channels, that is the postsynaptic side of the synapse. So in this case, because chloride is causing a depolarization, what that's going to do is going to make it less likely to have an action potential. That's why we call it inhibitory. An IPSP makes it less likely to have an action potential. It's a hyperpolarization. So just get used to that. Chloride channels will cause IPSPs. They hyperpolarize the membrane. They make it less likely to have an action potential. All right? Less likely for the axon hillock to reach threshold, and therefore less likely to have an action potential. In contrast, look at the sodium channel. So here, glutamate is the neurotransmitter. Glutamate opens sodium channels, and look, it causes a depolarization. The membrane becomes more positive, okay? So in this case, we call that an excitatory postsynaptic potential. Why excitatory? Because it's going to make it more likely to reach threshold and therefore more likely to have an action potential. So you see, this goes back to the whole way that neurons are communicating. In some cases, a neuron is releasing neurotransmitters that's telling the next neuron, hey, I want you to fire an action potential. I'm going to release some sodiums and create a depolarization that's going to create an excitatory postsynaptic potential. It's going to make that next neuron more likely to fire. But in other cases, A neuron might want to tell the next neuron, hey, don't fire an action potential. I don't want you to fire that action potential. So it's going to release inhibitory neurotransmitter. It's going to open chloride channels. So therefore, we're going to hyperpolarize the membrane and have an inhibitory postsynaptic potential, an IPSP. So get used to these. These are going to stick around for a while. IPSPs and EPSPs, all right? Very easy. We're either depolarizing or hyperpolarizing, either making it more likely to have an action potential or less likely to have an action potential. So look at here. If a neurotransmitter opens a potassium channel, the potassium flows out. So remember the sodium-potassium pump? It pumped the sodiums out and it pumped the potassiums in. Now, initially, people might think, okay, it makes sense. If you open a sodium channel, that's positive, so that creates that creates depolarization, makes the membrane more positive. And it's kind of common sense, open a chloride channel, that's negative, so that's going to hyperpolarize the membrane, going to make it more negative. Initially, I can see how you might think, well, potassium has a positive charge, so if you open a potassium channel, that's going to cause a depolarization and make the membrane more positive. But wait a minute. That sodium-potassium pump pumped all the potassium inside. Not all of it, but a lot of it. So now, if we open a potassium channel, potassium is going to flow from inside to out because of its concentration gradient, remember? So now we're going to have positives leaving the inside of the membrane. Therefore, the inside of the membrane is going to become less positive, which is the same as saying it's going to become more negative. Okay? So, that's what's going on here. We've got, therefore, potassium channels create hyperpolarizations. Okay? So, that's an IPSP. So, makes it less likely to reach threshold. So, just keep in mind, therefore, sodium channels cause EPSPs. They depolarize the membrane. Potassium and chloride channels hyperpolarize the membrane. They cause IPSPs. Calcium we're not going to look at, all right? We are going to be paying attention to sodiums, potassiums, and chlorides. So once again, sodium channels, opening a ligand-gated sodium channel is going to cause, or voltage-gated, wouldn't matter. So if we open a sodium channel, that's going to cause a depolarization. If we open a potassium or a chloride, that's going to cause a hyperpolarization. Okay? So let's go back and take a look here. We have the selectivity mechanism here for an ion channel. Remember, we looked at this before. I'm going to ask you now, is this channel going to create an EPSP or an IPSP? Think about it. What do those terms mean? What does EPSP mean? What does IPSP mean? This channel we can see is letting negative ions through. Therefore, it's letting more negatives inside. Therefore, it's hyperpolarizing the membrane. So, therefore, this would be an IPSP. Okay?